My name is Arif Dalvi, and I'm director of the Comprehensive Movement Disorders Center at the Palm Beach Neuroscience Institute. I specialize in Parkinson's disease and other movement disorders such as dystonia and Huntington's disease. And my interest in the specialty of Parkinson's disease, subspecialty interest is in surgical treatment of Parkinson's as well. The idea is that when you're dealing with a disease as complicated and as complex as Parkinson's disease, there are many symptoms. People focus on tremor as a symptom, but that's just the tip of the iceberg. It's a whole range of signs and symptoms that you have to look for, you have to measure, and then bring in a multidisciplinary program that includes beyond neurology, physical therapy, nutrition, and even neurosurgery in some cases to help the patient. In addition to a detailed examination based on standardized rating scales that allows us to measure the patient as a whole, we also include physical therapy as an important component. Advice regarding diet and exercise is critical. And also, as I mentioned, in certain cases, we bring in other disciplines, for example, neurosurgery, where deep brain stimulation is involved. The routine approach that you would get in a neurology clinic is where the physician asks you a few questions about your disease state, you answer, and based on that some medication change is made. There's not an attempt made to really measure all of the signs and symptoms as a whole. There's not an attempt made to quantify the disease and to bring in a multidisciplinary team. So I think that's what we're offering that is very different. There are certain areas in the brain when you have Parkinson's disease, they become overactive and they act as a brake on your motor system. So you slow down, you stiffen up, you have tremor. We can put in an electrode in those areas of the brain and make them work closer to normal. So the lay press calls it a pacemaker for the brain. I think that's a reasonable description because there's abnormal electrophysiology in the brain and you try to correct that with a pacemaker that brings things closer to normal. You do not want to offer the surgery too early in the case of the disease. If all they need is a small adjustment in medications, you don't want to go the brain surgery route. On the other hand, many patients, especially when they've had the disease 7 years, 10 years, they stop having a predictable response to medications, or they have a symptom that just does not respond. For example, you might have patients with tremor that no matter which medication you try, it's not controlled. So they can benefit from deep brain stimulation. When I see a patient, I am taking a holistic approach to their care. I'm trying to understand them as a person. I'm not trying to treat a disease. I'm trying to treat a person, and that is my goal.